for more on the pandemic and the latest on the CDC guidelines, as well as the soaring caseload across the country. NBC News correspondent Cal Perry is in Milwaukee, Wisconsin, where single-day COVID-19 cases and deaths set new records in that state. Also, NBC News correspondent Morgan Chesky in El Paso, Texas, where hospitalizations are climbing at a dangerous rate. And internal medicine physician and MSNBC medical contributor Dr. Lipi Roy. Morgan, we'll start with you. I lived in El Paso, Texas. I'm very familiar with those beautiful mountains behind you. I'm not familiar with that setup behind you. What's going on?
Lindsay, this is all part of the tragedy playing out in real time here in El Paso as these COVID numbers keep going up. These are just a few of the tents that have been brought in, manned by members of the medical community, with the Air Force, with the Army, trying to keep up with the influx of COVID-19 patients that are filling hospital after hospital here in this city. Some say that the worst is yet to come here. And right now, when you look at the hospitalization numbers going up, the death toll going up, you have to believe that that is somewhat true. Right now, one thing that is being called into question is a shutdown that's impacted this entire city for the past 2 weeks, and that's been basically challenged. We had a county judge issue this order 2 weeks ago, shutting down all non-essential businesses, trying to contain the COVID-19 numbers, but local government didn't necessarily enforce that. And so as a result of that, there was a lot of ambiguity as to what was allowed, what wasn't allowed. In the meantime, these numbers continued to rise, and along with the death toll with it. We know that just not too far from where I'm standing, Lindsay, we have those mobile morgues that are next to the medical examiner's office. We expect 10 of those in place by the end of this week, simply because they're running out of room to keep up with the bodies here. And on the other side of that, I spoke to one funeral home director who says that he has purchased 3 massive cooling units to handle the bodies coming in. He says his calendar is full and they can't do services fast enough to keep up with this tragic influx. Here's what he had to say in his own words. How do you explain, just from your perspective, a shutdown being not taken seriously as the body count rises?
Right. I mean, unfortunately, I see that people are taking a political stand to that this pandemic is due to the, politics. But I tell them, go to the hospitals, come to the funeral homes, and you'll see this pandemic is for real.
This pandemic is absolutely real. That city shutdown expires at midnight tonight. All eyes going to the county judge on whether or not he will extend it in the face of that current legal challenge, that lawsuit filed by a restaurant group along with the Attorney General of Texas. A lot of people are going to be tuning into that because that will really show how the enforcement will go in hopefully containing this virus. Meanwhile, as we witness firsthand, medical professionals doing all they can to do their part too. We'll send it back to you.
And Cal, Wisconsin just set records for cases, deaths, and hospitalizations. Please tell me you're not seeing what Morgan is seeing there in Milwaukee.
I think we're going to see it soon enough. You're talking about a state that has a 30% positivity rate. 1 in every 3 tests is coming up positive. That is a pandemic by all definitions. That is out of control. The hospitals here are stretched already at 85% capacity overall, with less than 130 ICU beds available. I'm at a mass testing center here in Milwaukee. There are mass testing centers now set up around the state. We've been talking to health officials that are worried exactly about what you're saying, that we could see what's happening in El Paso here in just a few weeks. One of the things that they wanted us to get out there is that it is very important when you are tested. Take a listen.
One of our biggest concerns is that people are showing up the day after or 2 days after contact with someone. It's too early to test, so you may get a false negative, and the implications of that are even more significant, where you have a false sense of security if you're asymptomatic that you were negative when you in fact may be positive, and you could then contribute to community spread.
And so when you are exposed and when you get tested is vitally important here, and not just here, but across the country, especially as we sort of make our way to Thanksgiving. That also has people here concerned. We heard from the governor last night in a rare primetime address. He is urging a stay-at-home order for everyone in the state, urging people to only go out when it is absolutely essential travel. That is, as he put it, to get tested, to get groceries, or to go to the doctor. The problem is, and you heard it from Morgan earlier, there is a disagreement between the Democratic governor, in this case here in Wisconsin, and the Republican legislature. They tossed out some of his stay-at-home orders back in March. So unfortunately for the governor, it's just a recommendation. It's not something that he can make a legality to force people, obviously, to stay at home, Lindsey.
Dr. Roy, we're hearing from Morgan there in El Paso. We're hearing from Cal in Wisconsin. Tell me about this new CDC.
If we continue to do more hits, guys.
Tell me more about this guidance from the CDC and whether this is enough to hopefully stave off disaster in the rest of the country.
Yeah, Lindsey, that was great reporting by Cal and Morgan at their respective states. Health professionals have been saying really since the start of the pandemic, but mostly from April, May, when we had the data showing that masks actually reduce infections. They reduce the transmission, I should say, of the virus. And yes, previously, the rationale was wear the mask so it protects other people, but now, and I'm not really surprised that wearing the mask actually does provide protection of a person wearing it and to those around him or her. But right now, Lindsey, we only have two ways to reduce the transmission of this virus. It is preventable. One is by wearing the mask, and the other one is the physical distancing. These two measures work, and they really need to be implemented and, frankly, mandated nationwide, Lindsey.
Let's talk about optimism and hope and how you're feeling right now about the prospects for a vaccine and the timeline.
Yeah, so that is actually good news. The vaccine by Pfizer and BioNTech is showing about 90% efficacy, which is right up there with the measles and chickenpox vaccines as far as efficacy. So that's really good news. It's using this new mRNA technology, which has really been validated by the research studies. But I want to also practice caution and make sure your viewers understand that this vaccine is not going to be available until like really mid next year to the general population. In addition, we need a lot more data. This is just preliminary data based on a press release. We need the original data so we can understand the duration of immunity and protection, as well as any other potential side effects that are long term. We just don't have any of that data, and we won't know that data for a while. So, but that said, I do have some optimism about that, but that does not by any means replace the fact that we need to all be wearing a mask all the time.
And Dr. Roy, Dr. Fauci giving stern warnings about Thanksgiving. A lot of health officials are encouraging people to have virtual get-togethers. Are you going to be heeding that advice, and do you think everybody should follow that?
So I absolutely agree with Dr. Fauci. I encourage all the viewers to look at the guidelines that the CDC has posted on their website. Look, Lindsey, 2020 is just got to be that write-off kind of year. You know, can't really be hanging out with family, large party gatherings. You just can't do that. Thanksgiving, Christmas is no different. Be your small family that you've already been isolating with, but avoid large gatherings, large sporting events. You can't do that. Share recipes online, but avoid large gatherings, Lindsey.
Dr. Lipi Roy, Cal Perry, Morgan Chesky, thank you all so much.